Bismillahir Rahmanir Rahim. Assalamu alaikum. I am Professor Adam Ahmed Adam. You are welcome to this mycology lecture in superficial mycosis. The lecture is composed of three short topics: Pityriasis versicolor, Tinea nigra, and Piedra. We start with Pityriasis or Tinea versicolor. هذا هو البهج. This disease is common skin mycosis. It is caused by the lipophilic yeast Malassezia species. The Malassezia species are part of the normal microbial flora of the skin. Example of the Malassezia species: Malassezia globosa and Malassezia furfur. There will be an overgrowth of the fungus on the skin. So the fungus will grow more than its normal limit. This disease is common in people with oily skin, and I would like to mention that it is not contagious. So the patient will not infect the healthy person. The lesion is a flaky skin hypopigmentation in the chest or back or both. So you see here the lesion on the back. The hypopigmentation is due to the bleaching effect of the azelaic acid produced by the fungus. The disease is just a disfigurement. It is almost symptomless. There may be a very mild itching. Diagnosis: clinical. Then if you cast an ultraviolet light from Wood's lamp on the affected part of the skin, it will fluoresce, giving colors like what you see in the picture. Then you take a skin scraping, you put the scraping on a glass slide, you add drops of 20% potassium hydroxide to dissolve the keratin, and then you, under the microscope, you can see the fungus. You see here the collection of the yeast, the rounded parts. Then you can culture in subbroad medium, as you see here in the picture. Treatment: topical antifungals like clotrimazole, metconazole, terbinafine, and other topical antifungals. There will be recovery, but unfortunately, recurrence is common. Then we come to Tinea nigra. The word nigra means black. This disease is caused by the yeast Hortea wernickeyi. This yeast is found in soil in tropical areas, and the disease is found in people who sweat excessively, where the eccrine sweat glands are highly concentrated. The infection takes place by inoculation, and the incubation period ranges from 2 to 7 weeks, and the lesion presents as paleless, black or brown skin patches in sole or palm. You can see here. Diagnosis: clinical. Laboratory wise, you take skin scraping, you put the scraping on a glass slide, you add drops of 20% potassium hydroxide to dissolve the keratin, and you can see the fungus under the microscope. Then you can culture part of the scraping on subbroad medium to have the growth. treatment, it clears without drug treatment, but antifungal drugs are used to speed recovery. But here there is an important point. Clinically, this disease mimics malignant melanoma. It looks like malignant melanoma in sight and color. In the sole, palm as black or dark lesion. So malignant melanoma, which is a serious disease, must not be misdiagnosed as tinea nigra. But tinea nigra itself is a very mild, not serious disease. It is just a mild disease. Black and white Piedra. Black Piedra, this is rare disease. It is found in humid tropical areas and among people with poor hair hygiene. So it affects the scalp hair. It is caused by the yeast Piedria hortae. The mode of infection is not known. The lesions will be small black nodules adherent to the hair of scalp, leading to breakage and destruction of the hair, as you see here. Diagnosis, clinical, and it must be differentiated from Pityriasis capitis. Pityriasis capitis is arthropod infestation caused by the lice, الجمل. Then laboratory investigation, you take the specimen is the hair, and you put it in a glass slide, and you add a drop of 20% potassium hydroxide to dissolve the keratin, and then you can see the fungus. Treatment, oral terbinafine. You can shave the hair first, and then you give oral terbinafine. White Piedra, this is caused by the yeast Trichosporum bigeli, affect the hair in any site in the body. The disease is not contagious. It is uncommon. The disease is quite rare. And there will be clusters attaching loosely to the tip of the hair shaft, so can be easily removed. Occurs more often in warm regions. Diagnosis, clinical. Then the laboratory investigation specimen is to take the hair. You add a drop of 20% potassium hydroxide to the hair on a glass slide, and then you see the fungus. And then also you can culture in subrod medium. Treatment, shaving the hair and adding topical drugs, topical antifungal drugs like ketoconazole or terbinafine, and you resort to oral antifungal drugs in case there is no response to topical treatment. Unfortunately, the recurrence is common. Prevention by improvement of personal and environmental hygiene. By this, the lecture is over. I hope that it is understandable, and I wish you all the best.